Good afternoon, my people. Let me start by welcoming you back to my YouTube channel, and more so, where we always get educational bangers, and many people are appreciating what we are doing in this channel. Most of them are appreciating because it's more educative and it touches the most common diseases which affect humankind. So, if you are there and you have not subscribed, consider subscribing and share with your brothers and sisters so that this channel can reach as many people as possible. And as always, I always start by appreciating you people, especially the returning subscribers, and each one of you doing anything, however small it is, to push this channel ahead. Feel appreciated, because if it were not for you, maybe this channel could not be where it is. And before we continue, if you are there and it's your first time watching this channel, make sure you hit the subscription button, and after subscribing, put the notification bell on so that whenever I upload a video like this, YouTube will automatically notify you and you'll never miss any of our content. We are still continuing with our chapter whereby we were discussing about bone lesion biopsy, which is the biopsy of the bones, and we were discussing about the conditions associated with bone marrow tumors or lesions, or conditions that can predispose one, or conditions that can cause bone tumors or bone lesions, which can lead or which can make a doctor order for a bone marrow or a bone lesion biopsy. These are the conditions that can push the doctor to order for a bone lesion biopsy. So the next condition is what we call the osteosarcoma. Osteosarcoma is a cancerous bone tumor that usually appears during adolescence. So it doesn't mean it can't happen in early stages of your age or later stages, but it mostly affects the adolescents. Osteosarcoma, cancerous bone tumor that usually appears during adolescence. We have osteitis fibrosa. Osteitis fibrosa, which is the softening of the bones due to hyperparathyroidism. Softening of the bones due to hyperparathyroidism. This is whereby the thyroid gland is overproducing. So that's why we call it hyperparathyroidism. We have rickets. Rickets is common, and this is bone weakening or weakening of the bones due to lack of calcium, which is very important in bone growth, vitamin D, obviously we get it direct from the sun, or phosphate. So rickets, which is common to children, involves weakening of the bones due to lack of calcium, vitamin D, or phosphates. A point to note, and this is very important, bone lesion biopsies can also provide surgeons with an inside view of your bones. Bone lesion biopsies can also provide surgeons with an inside view of your bones. Remember, in bone lesion biopsy, it involves drilling the bone. So when you drill the bone, the surgeon is in a position to get an inside view of your bone and determine any other condition that might be affecting your bones. So, bone lesion biopsies can also provide surgeons with the inside view of your bones. This is helpful when inspecting the status of infections or diseases that could be candidates for amputation, such as osteomyelitis. Very important. Bone lesion biopsies can also provide surgeons with an inside view of your bones. This is helpful, or it helps when inspecting the status of infections or diseases that could be candidates for amputation as osteomyelitis. Candidate for amputation means conditions that can predispose your leg to being amputated. Amputation means cutting off the affected part of your leg. And in most cases, it's always the below knee amputation. And I know in your society, you have ever seen somebody whose leg has been cut just below the knee level. That's what we call below knee amputation. So, bone lesion biopsies can also provide surgeons with an inside view of your bones. This is helpful when inspecting the status of infections or diseases that could be candidates for amputation, such as osteomyelitis. This is a common condition that can lead a person to lose his or her leg through amputation. In some cases, the biopsy can prevent the need for an amputation. How? How can the biopsy prevent the need for an amputation? During this process, you will be able, or the surgeon is able to inspect the bone and diagnose any cause of any tumor in your bone, and this leads to early management. And when it's managed early, through this you will be able to prevent amputation or prevent the need of amputation. Let's look at the preparation for a bone lesion biopsy. Preparation for a bone lesion biopsy. How do you prepare the client before the bone lesion is done? And as we said when we were starting, it's a surgical procedure. That means it's a bit invasive. So prior to your surgery or before your surgery, you have imaging tests to determine the location of your bone lesion. Prior or before your surgery, you have imaging tests to determine the location of your bone lesion. Remember, this lesion is not all over in your body, or it's not affecting all the bones in your system, but it's affecting a specific bone. So you have to do an imaging test to determine or locate the specific part where the bone lesion is. So prior to your surgery, you have imaging tests to determine the location of your bone lesion. Using these images, your surgeon will select the area from which they will take a tissue sample. That means the imaging or the images will direct the surgeon in getting the right location of your bone lesion. So prior to your surgery, you have imaging tests to determine the location of your bone lesion. Using these images, your surgeon will select the area from which they will have a tissue sample. Using these images, your surgeon will select the area from which they will take a tissue sample. You will undergo a physical examination. This is very important. You will undergo a physical examination. This is a good time to tell your doctor about any medications you are taking, including over-the-counter medication or supplements, and any allergies you may have. This is very important. You will undergo a physical examination. This is a good time to tell your doctor about any medications you are taking, including over-the-counter medication or supplements, and any allergies you have. You will most likely have to fast for 8 hours. Fasting means going without food. You will most likely have to fast for 8 hours before your biopsy. This is a standard procedure, especially if you are undergoing an anesthesia or a general anesthesia. You will most likely have to fast for 8 hours before your biopsy. This is a standard procedure, especially if you are undergoing a general anesthesia. General anesthesia means you will get drowsy or you will sleep, or it will interfere with all your body compared to the spinal anesthesia. For example, when you undergo, and I know many people, this is the most commonly used, the spinal anesthesia is always injected in the backbone or the spinal cord, and it numbs mostly the upper part. For example, when the ladies are undergoing a cesarean section, most of them get the spinal anesthesia. So the lower part gets numb, or it becomes pain free. He or she can see what is happening, but she is not feeling any pain. In the case of general anesthesia, you get sleepy. You won't feel anything, you won't see anything. It's like you are half dead. Whereby after the procedure, if the anesthesia is reversed, then you wake up. This marks the end of our video today. Thank you for accompanying me. Thank you for making me part of this family. Let's continue subscribing, sharing our videos so that they may reach as many people as possible. Have a lovely day ahead.